Learning has to be lifelong because you have to worry about trends. If you stay in the past, you get left in the past. So, some of the trends mentioned here are minimally invasive surgery, alternate care sites, and movement towards prevention from treatment. These trends are mentioned because many industries have to cater to these trends, and the polymer/plastic industry is one that plays a role in the current healthcare trends. So think of minimally invasive surgery, right? You're thinking of the alternative to things like open heart surgery. Here you still see plastics being used, right? And polymers that you have to think of in terms of their compatibility and what they're going to do. But you see the heart is open, and the recovery from that process is sometimes more difficult than the surgery itself. And in addition to that, you see they have to stop the heart from pumping blood and use this machine, which is a heart-lung exchange machine. They're pumping the blood, it's mimicking the function of the heart and the lungs. So compare that to something else. Some of our students have executed projects at this company, Bioventrix, and they work on a minimally invasive way to repair the heart. In this particular case, you have this section of the heart that has some scar tissue, and they are doing this minimally invasively. You see, they're not doing it in a way that the heart is open. They're monitoring the heart, of course, but they're inserting, see this giant needle in here, and it's going into the ventricle, and then they're trying to find a way to, you see this part is not pumping blood effectively. They're trying to find a way to minimize it so that the heart is functioning fully, and they're showing you how they do this under fluoroscopy. So in this particular case, what they're trying to do is put one piece of a biomaterial on this side and another one on this side, and then bring them to kind of close out. So you see they've inserted this particular material that's going to hold this side of the ventricle and another one on this side, and then they squeeze it together because this is dead heart tissue. So now they have the heart being more functional because this part that's dead, when it's pumping, it's not pumping effectively. So all of a sudden you've kind of put that part out of commission, and the person is more likely to live long. Now, another thing that is major is using robots to do minimally invasive surgery. Our students work at these companies such as Auris Health and Intuitive Surgical. Now at Intuitive Surgical, they have
of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies. Three network components comprise the Da Vinci surgical system: an ergonomic surgeon's console, a patient-side cart with 4 interactive robotic arms, and a high-definition 3D vision system. Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart. The precisely controlled micro-movements of the Da Vinci instruments are enabled by the computer processors of the system. These dedicated processors perform millions of safety checks over the course of a procedure for enhanced surgical precision and control. Da Vinci EndoWrist instruments are designed with a unique wristed architecture that provides 7 degrees of freedom for a range of motion greater than even the human wrist. This proprietary design enables surgical maneuvers impossible with conventional laparoscopic tools. The system requires that every surgical maneuver is under the direct control of the surgeon. Redundant safety checks prevent autonomous movement of the instruments or the robotic arms. The Da Vinci S surgical system moves surgery forward with a new level of technical capability that enables minimally invasive surgery in complex procedures as never before. Da Vinci provides a streamlined surgical experience that benefits the hospital, the surgeon, the OR team, and, most importantly, the patient.
So when I think of the gold standard of minimally invasive surgery, I tend to think of Intuitive Surgical. But we do have students that work there and students that work at Auris Health. And if you're looking at the whole components, if you watch the video and look at the system, you'll see plastics and polymers in use in many different scenarios, from the casing of the body to the thread-like material they're using to stitch up a wound. So all these plastics, polymers, choices that have to be made, they're things that happen along the entire process. Now, alternative care sites, that's very interesting because at the time of the writing, there was no COVID-19. Now, once COVID-19 hits, all of a sudden, alternative care sites are something that are actually very popular. So it's even gone beyond what was predicted as a trend to being a full-blown scenario where alternative care sites are popping up.
The Colorado Convention Center is closer to being operational as an alternative care site. It will be available for patients who no longer need in-hospital patient care. Starting on June 5th, the Convention Center and the ranch in Loveland have been prepared for use for patients who need low-level care while recovering from COVID-19 if hospitals get overwhelmed. There's still concerns about that happening if we get a big second wave, but right now, with only about a third of the ventilators in Colorado in use, the need does not look to be there yet.
Alternate care sites can even be in the patient's home. So what kind of plastics are suitable for those kind of applications? Those are some of the things you have to worry about with polymers. And then prevention versus cure. For prevention versus cure, you're thinking of diagnostics, early screening, the kind of materials that could be used for those applications. Let's hear from a doctor himself.
Technology standpoint. And where I rationalize, because I'm just like everybody else, you know, I hate to get a colonoscopy, I hate to go and get a prostate exam, but then I've seen the bad results that can occur from not getting your mammogram and not getting your colonoscopy and not getting the prostate exam, in terms of having to deal with complicated surgery or complicated chemotherapy or radiation that affects our quality of life. When you look at that, then it sounds like getting a prostate exam is very, very easy, okay? And getting a colonoscopy, yes, it's uncomfortable, but I'd rather be close to the commode for 24 hours than have to be getting a lot of chemotherapy and surgery. And so it is inconvenient, but it just, when you look at what you're saving, the distress that you're saving, that you're putting yourself and your family, it becomes a piece of cake.
So those trends are something you should be concerned about right now. In the future, the trends may differ, but you can start thinking of how you can think about polymers in those particular scenarios.